will be discussing torch infections during pregnancy. Torch, the word itself, it represents various diseases during the pregnancy. So first of all, we have the letter T here. T is for toxoplasmosis. O is for other infections such as group B streptococcus infections, hepatitis B, or it could be for HIV. R is for Rella. C represents Cytomegalovirus. H is for Herpes Simplex. On the next slide, we will discuss toxoplasmosis. Symptoms for the toxoplasmosis. It produces rash-like symptoms, and then it may also cause flu-like symptoms in the pregnant client. And transmission. It transmits through by ingestion of the raw meat, or it may also transmit by handling litter of the infected cats. That is why we always advise the pregnant clients to not to deal with the litter of the infected cats. Litter of infected cats, and it also transmitted from through the placenta to the fetus. So these are all the transmission modes of transmission for Toxoplasmosis virus. Effects on pregnancy. It causes miscarriage during the first trimester of pregnancy. Next are other infections. Other infections, group B streptococcus infection. What are the causes of group B streptococcus infections? It is caused by gram-positive bacteria, in which this bacteria, it colonizes into the rectum, vaginal area, urethra in a pregnant or in a non-pregnant client, and it also transmits to the fetus during the vaginal delivery. Effects on the infant. How it can affect the infant. Infant may develop the infection within the 48 hours of birth, or it may take a week for the infant to show the symptoms of infection, such as symptoms of pneumonia. It may cause sepsis in the newborn, or it may cause severe neurological issues in the infant. What do we do to prevent this? At 35 to 37 weeks of pregnancy, we do the cultures from the vaginal secretions and from the rectum, and antibiotics are initiated during the labor and during the birth, and we maintain contact precautions for this one. Next is rubella. Rubella is a teratogenic in the first trimester. It transmits to the fetus through the placenta. How does it affect the fetus? It causes congenital issues or defects in the baby or of the fetus, maybe eye problems, congenital heart defects, congenital brain defects, or the defects of ears. What do we do to prevent it? Vaccination. With each pregnant client, we check rubella titer. And if the rubella titer is below 1:8, that indicates client is not vaccinated. But the question is now, can we give this pregnancy during, or can we give this vaccination during the pregnancy? No, we cannot give this vaccination during pregnancy. It is given during the postpartum period. And one more thing I want to remind you guys is that whenever we give this vaccination, it is given in the postpartum period, and we always remind the client to not get pregnant at least for 3 months after receiving the vaccination for rubella. Next is Cytomegalovirus. Transmission. This organism transmits through the birth canal and also through the placenta or with the close contact. How it affects the baby, the fetus. It may cause hearing loss, or it may cause blindness, low birth weight, intrauterine growth retardation. Precautions. What kind of precautions we need to implement to prevent this infection? Contact precautions. Contact. And also, for pregnant client, physician may order antiviral medications, but antiviral medications may be toxic during the pregnancy, and the physician will consider risk versus benefit. Risk versus benefit prior to starting the antiviral medications. And of course, we need to maintain the contact precautions for this client. Next is herpes simplex. Transmission. Herpes simplex, it transmits to the fetus during the vaginal delivery or after the membranes ruptured. In this condition, the patient develops painful vesicles in the cervix or in the vaginal area. Effects on the fetus. It may cause newborn death or severe neurological impairment in the fetus. And precautions. If the active hepatic lesions are present, no vaginal examination is indicated. No vaginal examination, please. And delivery is usually done by cesarean section, and we maintain contact precautions in a client with herpes simplex. So that's all about torch infections during the pregnancy. I hope this will be helpful. Thank you.